We all know that cancer is a serious disease. But did you know that some infections can actually cause cancer? It's true. One such infection is caused by a bacterium called Helicobacter pylori, or H. pylori for short. This bacterium infects the stomach lining and is linked to stomach cancer. Dr. Nina Salama, a renowned expert in H. pylori research, has dedicated her career to understanding this tiny organism and its impact on our health. H. pylori infections are surprisingly common, affecting millions of people worldwide. Many people don't even know they are infected because they don't have any symptoms. However, for some, this silent infection can have serious consequences. By learning about the risks, prevention strategies, and treatment options, we can take charge of our health and reduce the risk of developing this potentially deadly disease. H. pylori is a type of bacteria that can live in the harsh environment of the human stomach. It's one of the most common bacterial infections worldwide. Its unique spiral shape allows it to burrow into the protective lining of the stomach. Transmission typically occurs through contaminated food, water, or person-to-person contact. This is especially common in areas with poor sanitation and overcrowding. Once inside the stomach, H. pylori can persist for years without causing noticeable symptoms. Over time, this chronic inflammation can increase the risk of developing stomach cancer. One of the most concerning aspects of H. pylori infection is its ability to remain silent for years. Many people who carry the bacteria experience no symptoms, making it difficult to detect without specific testing. When symptoms do occur, they can be easily mistaken for other common digestive issues like indigestion, heartburn, nausea, bloating, and abdominal pain. Because these symptoms are often vague, it's important to see a doctor for proper diagnosis if you experience any persistent digestive issues. Early detection allows for timely treatment and can potentially prevent complications such as stomach cancer. There are several tests available to diagnose H. pylori infection, including blood tests, breath tests, stool tests, and a biopsy of the stomach lining. Your doctor will recommend the most appropriate test based on your individual circumstances. Early detection is crucial for timely treatment and prevention of complications. How does H. pylori increase the risk of stomach cancer? The answer lies in the chronic inflammation it triggers within the stomach lining. When H. pylori infects the stomach, it disrupts the protective mucus layer, leading to inflammation. The body's immune response can also damage the stomach lining over time. As inflammation persists, the cells lining the stomach can begin to change, known as precancerous changes. H. pylori also produces toxins that can damage the DNA of stomach cells, increasing the likelihood of cancerous mutations. The longer the infection persists, the greater the risk of developing these precancerous changes and eventually stomach cancer. This highlights the importance of early detection and treatment of H. pylori infection. By understanding this connection, we can take proactive steps to protect our health. Early detection and treatment are key to preventing serious complications. While not all H. pylori infections lead to cancer, taking steps to prevent infection is crucial. Simple hygiene practices can reduce the risk of transmission. Dr. Salama emphasizes the importance of hand washing, especially before eating and after using the restroom. Food safety is another crucial aspect of prevention. Wash fruits and vegetables thoroughly and ensure meat is cooked properly. When traveling to areas with poor sanitation, be cautious about consuming food and water from unreliable sources. Within families, prevent the spread of H. pylori by using separate utensils and practicing good hygiene. By adopting these measures, you can significantly reduce your risk of H. pylori infection and protect your loved ones. The good news is that H. pylori infections are treatable. If diagnosed, your doctor will likely prescribe a combination of antibiotics to eliminate the bacteria. It's essential to take the full course of antibiotics as prescribed to ensure the infection is completely eradicated. In addition to antibiotics, your doctor may prescribe medications to reduce stomach acid production, allowing the stomach lining to heal. Follow up with your doctor to ensure the infection has been completely cleared. This may involve repeating some diagnostic tests to confirm eradication. By taking proactive steps to prevent infection and seeking prompt treatment if infected, you can significantly reduce your risk of complications from H. pylori. Knowledge is power when it comes to your health, and understanding the risks and prevention strategies associated with H. pylori is crucial for protecting yourself and your loved ones.